I'm Dr. Rita Mukhtar. I'm an associate professor in the Department of Surgery at UCSF and a breast cancer surgeon at the UCSF Breast Care Center. My research focus is in lobular breast cancer, and I wanted to tell you about the Lobular Breast Cancer Research Program at UCSF. To start, lobular breast cancer is the second most common type of breast cancer. So about 80% of breast cancer is invasive ductal carcinoma, and somewhere between 10 and 15% of breast cancers that are diagnosed are invasive lobular carcinoma. While there are similarities between these two cancer types, and for the most part, these cancer types are actually treated in very similar fashions these days, there are important differences that are increasingly recognized between ductal and lobular breast cancers. Lobular breast cancer is missing a protein called E-cadherin that normally allows cells to stick together. So these tumors tend to grow in a more spread out pattern. This can make it harder for us to detect these cancers on imaging studies like mammogram, ultrasound, and even MRI. This also can make it harder to get the entire tumor out with clear margins at the time of surgery. So people who have lobular breast cancer end up having to have more extensive surgery than people with ductal breast cancer in many cases. We also see that lobular breast cancers might not respond to systemic treatments the same way that ductal breast cancers do. So we have a number of research studies at UCSF that are trying to help gain new information about lobular breast cancer. We are testing different imaging approaches, including dedicated breast PET scanning using a tagged estrogen molecule, as well as other investigational molecules to see if we can get more clear images of these tumors and compare this imaging modality to other treatment types. We're doing sequencing studies to look for different mutations and proteins that might be differentially expressed in lobular breast cancers. We also have a cooperative group trial through the Translational Breast Cancer Research Consortium. This is called TBCRC 037 for postmenopausal patients who have lobular breast cancer to test different endocrine therapy strategies. Through the I-SPY trial, we also have a new endocrine optimization pathway where patients who have estrogen receptor positive cancers, like the majority of lobular breast cancers are, can enroll and actually get endocrine therapy plus new drugs that might work better than standard drugs. So we have a number of different research studies ongoing to better understand how to treat and prevent recurrence and prolong life for patients who have lobular breast cancer.